For 12 years, my brother Sam was in the spiral of addiction. But it never starts that way.
Sam, smile.
Growing up with Sam, we probably had a relationship that's not that unlike most brothers.
Okay, Joe.
We played sport together. We both went to the same school. We used to sleep in the same room. It was a typical Australian family growing up.
He was the classic middle child. He was probably the one that I worried about the most. He didn't feel that he was as academically good as the other two, but he seemed to have a lot of confidence in his ability to get on with people. He really could connect with anyone. It was quite incredible to watch.
People grow up with this idea of what a perfect family is. I think as you get older, you realise that that's not necessarily the case. Like most kids, Sam had his issues both at school and outside of school. But for him, his outlet became drugs and alcohol. I'd known he'd been using marijuana as he travelled through year 9, year 10 into year 11. And from there it progressed into prescription pills, methamphetamine, and by the time he reached his 20s, he was using heroin. Those incidents resulted in him finding solace in substances. And we sort of saw a shift in Sam.
When he started using drugs, we used to talk about it a lot. He was always remarkably honest about where he was.
You know, as our relationship degraded, I got angrier and angrier with him because it wasn't just my relationship, it was a relationship with the family. You know, I'm the oldest child. It's very hard to watch your parents worry and distress over a situation they really have no control over.
He'd go into the rehabs and he'd come out and he'd be fine for a few weeks and then he'd start using again. It was extraordinarily difficult to get support. Nobody wanted to talk to us, so happy to talk to Sam if Sam rang them, but they weren't willing to give us any help. It got to a point, I said, Sam, we love you dearly, but we cannot condone your behaviour, you have to leave. We were lost.
Sam was in the cycle of addiction for about 12 years, and one day he looked visibly relieved, and I asked him, you know, where did you go? And he'd been to a 12-step meeting.
Sam kept going off to the 12-step programs, finding where they were and then heading off. And I think that was a turning point when he saw that he was serious about recovery.
And I think from there, our relationship almost went back to normal because I felt like I could understand and sympathise with where he was at. We'd managed to put that behind us over a couple of months, and off we went. Yeah. Throughout the years with Sam, we'd learnt so much about addiction, about the family's involvement in addiction, about treatment. The idea was seeded that maybe we could do something about it, maybe we could actually give back in a way that would help people. Both my parents being doctors, they were instrumental in looking at how we can treat the medical components of detox and withdrawal. This is prior to us becoming a hospital, and how we would do that safely and effectively. My sister helped on reception and doing marketing. My brother was helping ferry clients up and down from the residential rehab and during day program. So as a family unit, we sort of came together and did bits and pieces in order to bring Arrow to life. So initially we started the day program in St Kilda in about 2014, but we always wanted to run a residential program. Addiction is really the symptoms that we see as a society, but the real problem is inside the individual. And treating addiction is one thing, but you've got to rebuild the individual at the same time, and that's what takes time. The early years of Arrow Health was such a struggle for a variety of reasons, but especially during those dark and particularly difficult days, the support of my wife Kristen and my children Artie, Imogen and Isla really helped me to push through and keep the dream of Arrow Health alive. I felt a sense of fulfilment when we opened the residential program. It was a wonderful facility, great outlook, real sense of calm, real country Victoria. And we just had some really good people involved, people that really cared about making a difference in the addiction space and were excited about doing something new.
I started up at the old rehab. So I just started working with clients. I would go up every, I think it was Sunday, Monday, Tuesday, and the program was all kicking off there.
I was sort of looking for a place to do my placement, and I knew someone who mentioned that there was a new facility that was opening up. And because we were sort of just opening, you know, there was a lot of groundwork to be done. When they first started Arrow, Sam being there as part of, you know, front of house and meeting the clients and being able to speak to them, you know, it gave them a space that felt safe.
Sam's personality was a lot more outgoing than I guess myself. He had an ease about him when he was talking to people. He was always seen as the fun person in the room, a bit of a larrikin. I think one of the big things about addiction is people feel isolated and alone, and Sam's ability to connect with them through his story gave people a lot of hope.
I can connect with that, the feeling of despair, and you know, I'm sure that you as a family are going through exactly what my family have been through, and that at the end of the day there is light at the end of the tunnel.
With the lack of regulation and stigma around addiction, it makes it a very difficult disease to treat. At Arrow, we believe that in order for the resident to get well, their family or their support structure needs to go on that journey with them. Because of the stigma associated with addiction, it was about helping the individual but also providing some sort of support for the family.
We recognised that the family therapy needed to be more than what it was, so Toby asked me, would I do more about the family program? And that's where I really sat and thought about, with my own history, my own story, what do families really need and want? I just identify strongly, you know, my own family went through addiction, starting with my then husband. So my youngest son, Jeff, got caught up in this. And as much as he was really talented, it did catch him out. You know, he got caught in this whole mental health conundrum that played out there. I was just finishing off some study and I knew he was in trouble. And unfortunately, he took his life that day. And it was awful. So what we all then ensured for all of us, you know, my other two boys, instead of trauma like that bringing you together, it blows you apart. Because counsellors and the medical team out there really couldn't cut it. They really didn't know what to do with me. And so the Lawrence family have had insight from the beginning. They knew it had to be family inclusive. So what I've done is continue to learn about it, know about it, because I believe it's only the people that have walked that walk and lived that really know how to meet someone empathetically in that moment.
A lot of the people that I work with here at Arrow do come from a background of, you know, addiction and recovery. I struggled with addiction. I had struggled with addiction since I was around 15, 16 years old. I thought that addiction would take me, and I'd sort of just reached a place where I was okay with that because I didn't feel like I could come back. When I became serious about staying clean, I had to close off that world, and it meant that I didn't know anybody. Andrea, my old manager, she reached out and spoke to me about there's more to life than being clean. You know, like I was clean, but I wasn't really in recovery. Arrow was the first place that sort of, I knew that every day I could get up and go to work and make sort of the same difference in other people's lives. I just think it's one of those key elements that helps people, especially in the beginning of early recovery, to feel safe. It's really unique, and I think it's really important for people to hear that.
Sam was a unique individual. He was almost a complete complement to what I am, both as a person and his outlook on life. It's great that we've been able to set up Arrow and do what we do, but we've had loss during that time. I was at the office and I was expecting him to arrive, and I got a call from my mother. She said, "You need to come home." Well, to her, "You need to come home now."
You know, he'd been through so much and we'd come out the other end and, you know, life was looking wonderful. Sam's death was a huge shock to us. And I think there was a point where we thought, can we keep on going with this?
I know I've lost a brother, my kids have lost an uncle, my parents have lost a son, but I think the world has lost a beacon of hope for what recovery can really be.
Arrow gave me a focus. I think we saw it as a way of continuing Sam's contribution to the world.
You learn to live with it, but I think it stays with you. And, it certainly took the wind out of my sails for a long time, struggling to come to terms with the fact that he wasn't with us anymore. Inevitably, you start questioning your impact and what you're doing. And I think we all felt that the work that we were doing with Arrow was important, not just for us, but for other people. The simple act of helping somebody else gives you purpose and gives you a sense of joy. And that's really why we continued to do what we did.
During our 10 years at Arrow, the stigma around drug and alcohol, it was still very prevalent, and we've sort of seen that change. It became clear that what people wanted was clear standards and regulation in the industry.
So they found the facility up there at Woodend, which was going to allow them to build the hospital and expand.
Towards the end of 2016, we moved to the Bentinck in Woodend. It was 45 minutes from Melbourne. We developed a good relationship with Kyneton Hospital and the GP clinics in the area. And we could really make it feel therapeutic. We could make it feel comfortable. I think the real turning point with Arrow Health came was when we went through the hospital accreditation process and became a registered private hospital, because it set us apart from every other addiction treatment provider that gave me and the team the assurance that the care that we were providing was legitimate and in line with best practice. The hospital section of the Bentinck is the Sam Lawrence Private Hospital. He's very much lives and breathes within Arrow Health.
Arrow started from a down point in our lives, and we've come so far and have done so well, but there's still a lot more to do with addiction.
We do detox and withdrawal well, but I think moving forward, I see us as really governing how the treatment of addictions needs to be done. Our role is developing into one where we can advocate for change against the stigma of addiction. We can advocate that recovery is possible. We can advocate that families and relationships can repair. No one at Arrow is there for the glory or the notoriety that comes with working in mental health. They are there to change people's lives, and they do it time after time, hour after hour.
I'm really grateful to be here, sitting here. The last 10 years, I feel like what we've really done is created a legacy. And part of my healing is, and why I don't get tired of this, is because it's so important to give back. And if I can give something to another family that saves somebody, that it gives the family what I didn't get, that mechanism of support and holding, then I think they've got a better chance. Because rehab's the beginning of the journey.
Before coming to Arrow and during my addiction, I viewed addiction as something that was lifelong, I think. After being here at Arrow, I just know that that's not the truth. You know, that recovery is possible for everyone.
We miss Sam. He would love to be involved with Arrow, see the results we've had, the people we've saved. He'd be really, really proud.
It does make me sad that he's not here and that he's not a part of this. It's a terrible fact that he's gone and he's missed out on the opportunity to see where Arrow has got to. But, you know, we do it as much as we can in order to keep his legacy alive, and we do it in a way that we think he would have been proud of.
Knowing what I know now and knowing where I've been through, I wouldn't change what's happened in my past. You know, I would never recommend to someone to go through what I have been through, and many of my friends, but I wouldn't change it. And, you know, it's a really beautiful part of my life where I'm at the moment, and things do get better. Things get better, but we have to go through a little bit of pain, you know, but it will teach us who we are today. It will make us a better person, and it will bring really beautiful things back into our lives that we may have thought that we could never get again.